From the southeastern corner of western North Carolina, this is Folklore. I'm your host, James Hernishin. The production process for most episodes of Folklore takes a few days, mostly because I have other things on my plate, but also because I'd rather not rush things if I don't have to. Crafting these introductions, as well as handling the audio files, can require a fair bit of sitting and staring at a screen while I consider all the possible options. But this interview, with an MD who is running for Congress on a platform of saving the country's healthcare system, was recorded while a fair bit of the country's healthcare system was hanging in the balance, thanks to a partial government shutdown that won't end until Congress can decide whether millions of American citizens will lose their healthcare insurance. I figured it might be a good idea to get this one up as soon as possible. Dr. Richard Hudspeth is the second major candidate to declare his candidacy for the job of congressman for North Carolina District 11, which includes almost half of Polk County, Saluda, Cooper's Gap, and portions of White Oak. The first was Jamie Ager of Hickory Nut Gap Farm. If you didn't already listen to my interview with him, it's the episode before this one. Richard Hudspeth is the former CEO of Blue Ridge Health, a nonprofit agency that helps folks in Polk and other counties in western North Carolina get the physical, mental, and dental care that they might not otherwise have access to. He's also a general practitioner, so it's fair to say he probably has a pretty good idea of what works and what doesn't in the U.S. healthcare system. Spoiler alert, it's broken. I doubt you will find too many informed observers in either party who will disagree with that diagnosis. Everyone says they want to make it better. The Democratic Party has promised to support the Republican majority's budget only if it restores financial assistance to those on government health insurance, because without that assistance, a lot of people's premiums are going to double in a couple of months. The Republicans say they are willing to talk about that, but only after the Democrats let them pass their budget. Here's House Speaker Mike Johnson, a week into the shutdown, explaining the Republican Party's position.
They decided that they would pick a fight on health care. Well, let me look right into the camera and tell you very clearly, Republicans are the ones concerned about health care. Republicans are the party working around the clock every day to fix health care. This is not talking points for us. We've done it. A big part of the One Big Beautiful Bill, the Working Families Tax Cut, was to fix health care. Health care is broken in America. It's too expensive. The quality of care needs to rise. We need more access for more people, and we have lots of ideas to do that. But that issue is for debate in the next 3 months. It always was. We have members working on that.
It's easy to identify the flaw in Johnson's argument, given his party's record on health care. It opposed Obamacare from day one and has never put forward even a conceptual proposal for an alternative that would help working-class Americans afford health insurance. Also, the GOP could pass their budget any day without Democratic support if it really wanted to. But because not every Democrat is on the same page about whether health insurance is the right issue for finally standing up to the president, I asked my guest to weigh in with his thoughts on what his party should be doing. First, though, we talk about why he wants to be a member of Congress at this particular point in history. We recorded our talk at the Saluda Library on October 8th. Richard Hudspeth, welcome to Folklore.
Super excited to be here. Thanks for having me.
I think there's a fair number of people within a certain segment of the population of Western North Carolina who are very familiar with you because you've been around for quite a while and done a lot of things. But for the average folk, especially in Polk County, they may not be familiar with your name. So give me your life story as concisely as you think appropriate and leading up to your decision to run for public office.
So I grew up primarily in Chicago, moved to North Carolina in the early 80s. Went to school here, went to Duke University, graduated with studies in economics and languages. So I studied Russian and Mandarin Chinese. My first job after graduating was in mainland China, so the People's Republic of China. Spent some time overseas after that, and I found myself traveling and trying to have different experiences. And one of those experiences landed me in Calcutta, India, And I worked and volunteered at Mother Teresa's home for the destitute and the dying. That was a transformational experience for me. So I met a young man, and he was not really much older than myself at the time, and he had tuberculosis. If you're not familiar with Mother Teresa's home, they take people off the street who are living in poverty, don't have a home, and try and get them well enough to get them back on the street and give them another life, another chance at life. So I met this young man and had a strange request for me. He wanted his head shaved. Didn't speak the language, but figured it out. I shaved his head, and he was so super excited by that. He gave me a smile as wide as the Ganges River is long, shook my hand, and I felt like, wow, this is incredible. You know, what it feels like to give someone, you know, just a little peace of mind and a little dignity. Went home to the hospital, not home, but went to the hospital that night, came back excited to see him, and he had died that night. And what I realized afterwards is that in the Hindu religion, shaving your head is a way of symbolically transitioning from this life into the afterlife. He knew his fate from tuberculosis, that he was going to die. I felt crestfallen, of course, but I realized at that time, that was the moment that I said, I know what I want to do. I want to go to medical school, and I want to help people. He died from poverty and lack of just basic health care. And I wanted to go and help people who are left out and left behind. So I came back to the United States, started my trek to medical school. Of course, economics and language majors. There's a few science classes that I didn't take, so I needed to fulfill that. Soon to be married to my wife. She was doing a master's program in environmental education, so we did that. I worked, helped support us, took classes. She finished her program. We returned back to North Carolina and went to medical school at Chapel Hill. Did that, great experience, was a rural health scholar. Some of my rotations were in rural health up in Mount Airy and in Bakersville. Loved it. When that was over, in medicine, you go and do a residency. I found family medicine to be my home in medicine. I love doing care for all, delivering babies, helping families, their kids. Ended up doing a residency program in the University of Cincinnati, and then did a fellowship in obstetrics at the University of Utah. And why that's important is because I knew I wanted to do rural care, and I also wanted to deliver babies. But if I'm going to be in a rural area, I wanted to be able to take care of that family and that mother without, delay, essentially. So that obstetrics fellowship allowed me to do C-sections and do high-risk obstetrics. I came back to North Carolina, found a job in the Hendersonville Family Health Center program, and that was over 20 years ago. So I started training residents, also got involved with community care, which was sort of the Medicaid delivery system before managed care stepped in. And so I was on, for example, the physician advisory group, helping Medicaid create policy, et cetera. In about 2015, I was transitioning from that role to go to become the chief medical officer at Blue Ridge Health, which is a federally qualified health center here in Western North Carolina. Just prior to that, in the transition period, I actually went to Sierra Leone in West Africa to help with the Ebola epidemic back then. And that took about, 2 to 3 months time. When I came back, I had to quarantine for 3 weeks doing that. But nonetheless, came back and began as chief medical officer. And then just a few months after that, became the chief executive officer at Blue Ridge Health. And spent 10 years in that leadership role at Blue Ridge Health in order to really expand the work that we did as a health center. We can talk about that in a little bit as well. I decided in December that I wanted to step down as CEO and be a family doc again. And then...
Sorry, wait, I'm like a GP?
Yeah, I'm a family physician.
Okay.
Uh-huh. And so just to do patient care, not just, but to go back and do what I went to medical school for, and that was to see more patients. I had continued my clinical care throughout my whole career, but had to scale a little bit back as I was, the CEO at the health center. And then, so I had spent my life, I tirelessly advocated that everyone should have access to compassionate and affordable health care. No matter their income, I believe that everyone deserves access to affordable health care. And what we've seen in the past 9 months is really this disastrous dismantling of this healthcare system, erosion of trust in medical information, and massive cuts to critical research that threaten future medical advances. And I started thinking, they are taking apart by 1,000 cuts, piece by piece, what I've spent my career building. I started talking to people about what this might look like. And through those discussions, here I am now as a candidate for NC11.
So, summing up, the current government's approach to public health obviously hit a nerve for you, and you have to do something about it.
Absolutely.
Okay.
Absolutely.
And just so you know, while our listeners know, while we're talking, the U.S. government is in partial shutdown mode because the Democratic Party is insisting upon extending premiums for people on EACA, Affordable Care Act, and the Republicans are refusing to agree to that. And so stalemate in the Senate and government gets shut down.
Right.
Do you agree with the Democratic Party's decision to shut down the government over this?
I mean, this is just one thing. So the Affordable Care Act subsidies, right? What will happen if we don't do something different is that these will at least double, right? People's subsidies. They wanted to have this continuing resolution just go through November, but that's the new enrollment period. People are going to sign up and then suddenly they're going to pull the rug out from under them. No, it wasn't $700. It's actually $1,400, right? But there are so many things that are happening right now. How do you pick and choose what one thing you're going to sort of argue with, the Republicans about as to whether you're going to shut down the government? What they're doing to healthcare, this is just the tip of the iceberg, right? There are so many other things happening. Medicaid expansion's at risk. Medicare's at risk. Our rural hospital systems are at risk. What Chuck Edwards voted for was a $50 billion cut to healthcare in North Carolina. That's a loss of about $20,000 for a family of 4. That's an unprecedented tax on North Carolinians. And who's going to pay for that? We're going to pay for it out of our pocket. And we're also going to pay for it out of our health, because we'll see fewer nurses taking care of our sick loved ones in our rural hospitals. We'll see more cuts to services at our rural hospitals. And we will likely see more closures to our rural hospitals. So this affordability subsidy really is just the tip of the iceberg. At some point, everyone, we all have to plant a flag and say, enough is enough.
Okay, I think that answers the question. It's just, I ask it because the argument in Democratic circles seemed to be between those who support the notion of using the threat to the medical care system as justification for the shutdown, and those who think, no, actually, we should let the medical system collapse and people start to suffer so people understand the consequences of the current Republican government's approach to government.
I'm a physician. I don't believe letting people suffer is necessarily the right thing to do. But let's not be mistaken about this. It's a great little thing that they're trying to do, right? Who controls the House? The Republicans. Who controls the Senate? The Republicans. Who controls the executive branch? The Republicans. And whatever you want to say about the Supreme Court, 6-3 majority. The Republicans own this government. They're trying to flip it to us, saying the Democrats are shutting it down. Pass a bill then. Pass whatever it is you want to do, and we will see the suffering that people will go through when 16 million people across this country lose Medicaid. When we'll see 630,000 people who got expansion, Medicaid expansion in this state, no longer have health insurance. When we see rural hospitals, like I just mentioned, lose funding because they don't have patients with insurance, Medicaid, Medicare, those are the things that we're fighting for. That's what I've spent my life doing, and this is why I'm in this race today.
Are there any other subjects that you've sort of, done some research on, dug your teeth into beyond the medical aspect?
Absolutely. What we've seen, for example, from Chuck Edwards, based on what he's been able to accomplish, is shut the government down and broken promises to make America affordable again, right? We have an affordability crisis in this country, and healthcare is part of that, right? But we still, affordable housing, really non-existent. The price of groceries and childcare, higher than they've ever been. And I think there are a number of ways that we can actually deal with this as a country to make things better. Let's take affordable housing. So I think there's a good model within the community health center model that we could use similarly to our housing crisis. I've talked to a number of housing crisis advocates in our area, mainly Buncombe, but other places as well. And I think there are models that we can use similar to the community health center model, this sort of public-private, non-profit partnership model that can actually accelerate our ability to invest strategically and wisely in essential services for human beings: healthcare, housing, adequate pricing on food, good food, access to healthy food. Those are the things that I think that we can learn from some of the models that we have out there that we're not using in order to solve some of our problems.
What would you tell your average Polk County voter who might, I don't know how many of them are out there like this, but who are looking closer to the local level when they're trying to figure out who to support in this primary that you're running in? Because let's face it, most people these days are functioning with a media diet that is primarily national in scope because we don't have a lot of other local news. So if you could reach out to someone who's concerned about what Congress people can do for them at the local level in Polk County and the 3 other 15 counties in Western North Carolina in your district, what would you tell them?
Well, first, let me tell you on a grander scale of what we were able to accomplish within our community health center in the past 10 years under my leadership. So we have clinics in 9 rural Western North Carolina counties. I've had to balance a budget, but also expanding services to the communities to always meet their needs. I've had to balance fiscal responsibility with making strategic investments in innovation and growth not just for profit's sake, but to improve lives. And under my leadership, we were able to more than triple the number of patients who have access to affordable health care in Western North Carolina, quadruple the number of clinical sites, quadruple the number of providers now serving in our clinic sites, and we quadrupled our workforce to over 700 employees. Let me bring that down. That is in general what we did. Let me show exactly what we did in the past 10 years in Polk County. When I started as the chief medical officer and was transitioning to be the CEO, our health center had applied, to open up a community health center in Polk County, and initially was refused by the federal government. And then, out of the blue, they send you a letter, no warning, anything. You can go ahead and do it, and you have like 120 days to get it started. You're like, what happened, right? But that's the way it worked back then. So there was a free clinic that was having trouble in Polk County continuing to exist. We worked with them to become sort of that free clinic as well as a health center, right? We offer affordable care. If you can't afford to pay, we're going to see you. If you've got money to help support what we're doing, we ask you for that as well. I was the provider that came down as the chief medical officer until I could hire some folks. So I was seeing patients here. We had a counselor who had come over from that previous operation, still working with us today. Fantastic woman who's been down in Polk County forever. In addition to that, now we've more than likely quadrupled that. We have a number of providers, a number of behavioral health providers. We also saw a need. There used to be a health district between McDowell, Rutherford, and Polk County. That kind of collapsed a little bit. And one of the things that happened was that health district used to run a dental clinic, the Collins Dental Center in Columbus, and they were shutting it down. So the community came to us, knowing that we did dental care. And it's like, can you help us? Can you save our dental clinic? And we stepped in. We figured out how to do it. That dental clinic is still here and still going strong because of that. We actually then worked, for example, with the health department. So the health department came to us and said, this seems like inefficiency and not really effective work for us to be trying to duplicate what you're doing when you're doing such a great job of it. Why don't we have the health department do what the health department needs to do, and you all continue to see the patients that we see? So it's very few operations in North Carolina that have a community health center and a health department so intertwined that we're taking care of patients along that. That's cost efficiency. That's cost effectiveness right there. In addition, we have access to low-cost medications. It's very expensive to open a pharmacy in a place, but we do delivery service to Polk County residents in order to make sure that they have access to affordable medications. And last, and certainly not least, is we have a lot of community school-based health programs. And so we opened some school-based health programs in Polk County. Again, it was the school, combination. Do you want to do this? Here are the benefits that we've seen in other communities. When we opened, I remember having an administrator come to us and he's like, that was unbelievable. It was almost like the first patient we had seen. He said, under a circumstance without a school-based health center, we would have had to call the parents. They would have had to come pick the child up, leave work, get an appointment somewhere else, spend a half day, full day, lose all of that. We sent that child to the health center, and within 30 minutes, that kid was back in his seat, learning, parents still at work, getting the work done that they needed to do, right? So those are the things that we've done on the ground here in Polk County in order to show how we can work together to take advantages of opportunities to bring great things to Polk County.
Well, it sounds to me like if you were to win this primary and actually win the race against Chuck Edwards, assuming when, you would be one of the first congressmen to have experience working with Polk County residents in a long time.
And I have that in other districts as well. So a lot of my work was in Henderson County where I serve patients. But like I said, we have clinics in 9 Western North Carolina counties.
Well, that sounds like a good resume to put in front of a voter.
I think so.
Okay.
And I also, if I can, James,
Sure.
just say that I think, as I said, what's happening today with this shutdown is just the tip of the iceberg, right? There's a lot. When Roy Cooper announced for his Senate seat, his number one issue was healthcare. Healthcare, it's complicated. There are a lot of things coming down in 2026, or the rest of 2025 for that matter, that need expertise. Roy Cooper, similar to Governor Hunt, was our education governor. Governor Cooper was our healthcare governor. We need to help him win the Senate seat. We need to help him preserve healthcare. And I think I have the experience and wisdom to actually understand the policy and what we can actually do with healthcare.
So you've got, obviously you've thought about your campaign and what you're going to focus on, at least for the election. But for the primary, which is your immediate hurdle, how are you going to reach out to as wide a possible array of Democrats? Because we have got a rather curious history in this district. I insist upon talking about Mo Davis because he was poised to become our congressman, but lost to Madison Cawthorn, who was run out of town out of embarrassment, even by the Republicans.
So you've got to appeal first to the Democrats who, like across the whole country, a lot of whom are crying out for a fighter, someone with a little bit of feisty attitude, who's not going to just play by the same old rules that have basically sidelined the Democratic Party. On the other hand, this is a relatively conservative part of the world, and some people don't take kindly to foul-mouthed Facebook posts. So, how do you carve your own path through those kind of two different approaches to what Democrats are looking for from their candidate?
So absolutely, the first election is the primary, but I'm also building a wider coalition, right? The largest voting bloc in Western North Carolina are unaffiliated voters. Some of them are Democrats. Some of them are truly independent, if you will. Some of them are folks that have left the Republican Party. So we need to appeal to them. We need to appeal to the Democrats and any Republicans that may be interested. I can tell you that I have Republicans already supporting my campaign. These are folks that I was a lifelong Republican. I don't like what's happening, and I like your message. I like your experience. I like what you've done for Western North Carolina. I have a multi-generational campaign. I have high school kids that are just going to be eligible to vote coming on board to help our campaign. All the way, to folks in our long-term care facilities, right, that are interested in this campaign. I have a multicultural campaign, right? Because that's what Western North Carolina looks like right now. So I'm creating a coalition that will, I hope, transcend sort of these labels, these one-word litmus tests, Democrat, Republican, whatever the case may be. I think it was Kierkegaard who said, as soon as you label me, you negate me. I want to open a big tent, a big wide tent. And it's not, I'm going to be a fighter, right? Not going to necessarily do it how other people have necessarily done it in the past. It's just a different lifestyle. But I also have a proven track record of getting things done, accomplishments. And I think more than anything else, there's a large group of people in the middle, whatever percentage you want to call it, 60%, 70%, that are tired of this chaos and want real positive change. And so I'm a fighter, but I'm also a fixer. I'm going to get it done.
You don't have a political history, right? You have not been a politician up till now, other than in the literal sense that a CEO has to play politics to some degree.
And I wouldn't say I'm a politician now. I'm still who I am, family doc. But go ahead.
But just that success in a primary usually requires a fair bit of connection, a fair bit of networking within the party that you're running under. How much attention have you paid to building those connections?
Yeah, so a lot of attention. You're right. I'm a newbie to this. I don't have a political legacy, political family, and I've had to build that coalition. So you asked, how did I decide to get into this? A lot of that was just a lot of groundwork, just talking to folks. So I've talked to by phone, in person, email, at least 6 of the past Democratic candidates that have run in this district. One didn't win, etc. I've talked to current politicians and past politicians, Republicans and Democrats alike, at all levels of government level. I talked to the 4 North Carolina U.S. House representatives in North Carolina. Reached out to all 4. I think I talked to 3 of them, and some of those past ones as well, who are no longer those, to understand, is this doable? How do we do this? Tell me what I need to do to build this coalition. So I've already started building those bridges. I have a lot of work to do, there's no doubt about it, but there's still 5 months until the primary. That's an eternity in politics, really, right? We have no idea what's going to happen necessarily down the road. And I think that I got in when I got in. It was late mid-September, just because I had to make sure that I treated that community health center and my board appropriately. And they needed time in order to fill my seat. I told them in December. It took them till kind of the end of August in order to get my replacement. I have a deep sense of loyalty to the board, to my employees, to our patients. And I was like, okay, if it takes you that long, that's okay. I'll get in September and we'll be okay.
In response to one of my earlier questions, you pointed out the most North Carolina voters are independents, and you don't have a history as an activist within the Democratic Party. So what is your take on where the Democrats should be going? In other words, if you join the party and you become a congressperson, do you want to see the Democratic Party return to its roots, or do you want to see them move in a different direction? And if you want to go with the roots, which roots are we talking about? Because to be honest, I think the big challenge of the Democratic Party right now is it's not really sure where it's going.
So the Democratic Party is made up of individuals. And what we first need to do is find the right individuals who have a message that resonate with the voters. And then let's build that coalition from there. What I think the Democrats have an opportunity to do, and again, we're labeling like this is a broad coalition. I have Republicans who are now on my campaign, voting for me, et cetera. I had one said, Richard, I know when I made that contribution, I was going to end up with Act Blue on my credit card slip, but I did it for you, right? This is a broader coalition. What I think that we have a great opportunity to do is we've seen what destruction and how easy destruction is, right? You can take a building down pretty easily. Putting it back up is really hard. We're going to have an opportunity based on what this destruction has happened during this administration and another 3 years from now or another year, whatever that looks like, to rebuild in a different way. What does that look like? Well, for one, I think we can address affordability. I think we can address healthcare. I think we can address a lot of things that Congress has neglected to do. The last time any sort of significant immigration program was passed was back when we had a coalition with a Republican president, a Republican Senate, and a Democratic House of Representatives. That was 1986. That's 40 plus years where we haven't had any significant immigration legislation.
That's a period of time where the president, Ronald Reagan, was basically a pro-immigration president. We're not there anymore. I mean, even some Democrats are running away from pro-immigration stance. I mean, I don't want to dwell too much on the shortcomings of the Democratic Party, given that the Republicans obviously have at least as many shortcomings. It's just that I'm curious always about any candidate's decision of which party to run into, or did you think about maybe running as an independent?
So we have a two-party system. There's no doubt about that. To run as an independent is particularly difficult to do. As I mentioned at the beginning of this, I grew up in Chicago. I've been a lifelong Democrat. But I'm in the moderate range of Democrat, right? And I think that appeals to, as I've said, Republicans, independents, unaffiliated, et cetera. And I think there's a larger group there in that middle that is interested in getting things done. So when you say maybe some of these things, well, we're in a different place, I still think there's a lot of people that want to see some of these problems fixed rather than just screaming at each other about it. So although I haven't been active, so to speak, in Democratic Party politics, I've been active politically in the sense of what I needed to do in order to continue to make healthcare possible, in order to get community health center funding. I lobbied Chuck Edwards for 10 years when he was a legislator, a state legislator, to get Medicaid expansion. I think he got tired of seeing me. We're not talking about Medicaid expansion, Richard. And it's like, I'm sorry, I am going to talk about it, right? And he was against it until he voted for it, and then he ran for Congress. And then he's trying to get rid of it again with the one big, bad, barbaric bill that they have, right? So I I think that our message needs to be focused on this is what we can do to help people. And healthcare is going to be that number one issue.
All right. Well, unless you've got something else you want to talk about, and that kind of covers it, I just want to make sure that in my own head, you're kind of like a reluctant convert to the notion of being a politician, but your dissatisfaction with what the government is doing to the healthcare system in this country pushed you over the edge. Is that right?
I think that's a fair statement.
All right. Well, then we'll leave it at that.
All right. Thank you.
Thank you so much.
Unless some other candidates of note crawl out of the woodwork in the next couple of months, that should do it for the NC11 Democratic primary. I hope to be talking to one Democratic hopeful for NC14, which includes Columbus, Tryon, Mill Spring, and the rest of White Oak, later this month. If anyone emerges to challenge any Republican incumbent, I will invite them onto the podcast too. Filing for the primaries opens in December, and the primaries are in March. Meanwhile, if you've got any suggestions for guests or topics, send them to jamesh@polklore.com. Thanks for listening.